Back now with our special series, Thanks and Giving, where we focus on the work at St. Jude's Children's Research Hospital. Our Today National correspondent Jenna Hager is here with more. Jenna, good morning.
Good morning. St. Jude gave us a rare look at a young cancer patient and her family with a very uncertain outcome. It's August 10th, and Paishence Joy Watkins, who's 9, is arriving for surgery at St. Jude Children's Research Hospital. Her mom, Nanette, tries to remain positive. 4 months earlier, she found out that her only child has osteosarcoma, a malignant bone tumor in her leg.
I heard them, but I couldn't feel what they were saying. I became numb.
Paishence has already been treated with chemotherapy. Doctors say surgery is also necessary.
Well, we knew that Paishence was going to require a limb salvage surgery where we'd have to take the cancer out and then reconstruct her hip joint.
I say if it's in there, get it out.
With anxiety in the air, her family sends her off to the OR.
She loves you guys.
Hoping for the very best. Nanette fears the unknown, including the possibility of her daughter losing her leg.
I'm scared to death. What if they cut her and it spreads in her body? You know, what if something goes wrong, they crack the bone and can't use it?
Before she became ill, Paishence was a precocious girl.
Tell me what she was like growing up.
She liked to play in the dirt. She liked to jump on the bed, you know.
As active as she was, her mom became concerned when she constantly complained about pains in her leg.
At night, Mom, my leg is hurting. And the first couple times I took her to the hospital, they told me that she was having growing pain.
After noticing severe weakness in her right leg, Nanette insisted on further testing.
They said, well, there is something wrong. Paishence has a mass in her right leg, and we want to send her over to St. Jude Hospital.
Results from St. Jude revealed bad news.
Do you remember the moment when the doctor said Paishence has cancer?
Well, they came in the room, and they said, well, we want to take Paishence out for a moment. Right then, I knew they didn't have good news, and it felt like I just held my breath.
For a mom, that must have been really hard to hear.
It was really hard, and it took me a long time to exhale.
The prognosis for children with osteosarcoma is far better today than in years past.
25 years ago, most of these patients would get an amputation. We started developing techniques to save the legs. At St. Jude, we pioneered the ability to put a prosthesis that actually would grow as the other leg grew.
A scan of Paishence's leg shows the tumor before surgery.
All this white area that you see here is the cancer. At St. Jude, our survival rate's about 65%.
So it's a pretty serious cancer.
It's a very serious cancer.
6 hours after surgery began, Paishence is reunited with her family.
Everybody was so happy. I cried like a baby. They said her leg is okay, Mom. The surgery went well, and I just, woohoo, you know.
A few weeks later, with her mom looking on, Paishence puts pressure on her leg for the first time in months.
This is like a newborn baby walking again.
My baby
hasn't walked since April.
You're still pretty little. When you heard you had bone cancer, what went through your mind? Did you understand what it was?
I understand it was an illness, and my heart was really broken.
Surgery was the scariest part of all.
I was wondering if they were going to cut my leg off or what was going to happen. I was really scared, but when I saw that my leg was still there, it was like a relief.
As her body heals, Paishence is exercising, well, patience.
Now I can actually stand up and put pressure on my foot.
What are the things you look forward to doing once you're done with treatment?
Playing outside with my friends again, climbing trees, and riding my bike again. So proud of you.
And Paishence's mother, Nanette, is a single mom and initially was very worried, of course, about cost. She was relieved and thankful to learn that money wasn't an issue at St. Jude. So that really is one of the amazing things that your dad did.
That's right. Marlo Thomas is here, the National Outreach Director for St. Jude's Children's Research Hospital. Marlo, just an amazing story. But is Paishence going to need any more surgeries?
Well, what's amazing about this limb salvaging treatment that we've come up with, we've pioneered it. In many hospitals, she would still lose her leg. But what we do is we cut out the part that has the cancer. We put in a titanium rod. And then we remotely, every month or so, we measure her other leg, and it grows like a half an inch, and then we remotely expand the titanium rod. So she won't have any invasive surgeries until maybe she's 22 and fully grown, and then we'll put in a permanent rod. But that's amazing that in the old days, even when we began, we would have had to go in and do other surgeries to expand that leg.
She's kind of bionic.
Yeah.
That's amazing.
And you know, it's only a minute and a half procedure.
Wow, that's terrific. Marlo, Jenna, thanks so much.